Oh, hey there, this is Dr. Evan Osar with Integrative Movement Insider, just working on some shoulder stability. Happy Sunday. Hope your week is ended and or beginning well. I just had a client. I actually had two clients, brand new clients this week coming in with shoulder issues. And different shoulder issues, however, very similar sort of presentation. One was 63 or is 63 and one is 73. And the one fell, 73-year-old fell, and she tore three of her four rotator cuffs. She tore her labrum as well. And she's planning for a very active summer, supposedly. However, she's going to have surgery here pretty soon. And she wanted to have my opinion on whether or not she should have surgery now, what she can do to prepare for surgery, and then what will happen after surgery. So we're helping her develop a strategy around that. Now, the other woman, 63, she came with a primary goal. She looked me out, sought me out specifically because she's like, oh, you're the person that can help me. I want to increase strength. I've been looking and reading a lot about longevity, and we know, and the research is very conclusive on the importance of strength training, resistance training, and the decrease of all-cause mortality and the increase in longevity. Meaning, the more muscle mass you have and the stronger you are, the longer you are likely to live. So I'm like, you are absolutely correct. However, she also presented with a long history, a long medical history. And this is why it's so important you understand your client's medical history. I say this over and over and over because it's so important. Because if I just listen to her primary goal, which is to improve muscle strength and improve longevity so she can function better as she gets older, then I would have failed with her. However, I started to ask her some specific questions, or she shared a lot of information, but then I started to ask her more specific questions. And more specifically, she hasn't exercised in 4 years. She can't lift her arms above this position. And she was actually helping herself lift her arms, and it was about that high that she could lift her arms. So I want to ask you as a health and fitness professional, what are you going to do with that client that can't even get her arms overhead? She's had a history of going to the hospital with swelling around her cerebral area, her brain stem area that actually caused her to lose function of both arms. She's had multiple whiplash type, significant whiplash type injuries, and she's had this chronic issue with chronic neck pain and shoulder pain and tingling down her arms. So please tell me what you're going to do with her to start with her when you first working with her. Again, looking at her primary goal of increasing muscle strength and muscle mass. As I learned more about her history, in addition to her multiple whiplashes and she hit her head on the dash during a car accident, I also learned that she had two sets of breast implants. One set imploded and they had to redo the breast implants. She also had a complete hysterectomy, so again, significant abdominal surgery, and she had a C-section with her first child. So the question may be, or is, I should say, how do these things impact? I'm going to focus specifically on the abdominal surgery because she's like, I never heard this before, why surgery or how surgery can impact my shoulders. Well, when you think about it, it's very easy to see if I pull my shirt. So now we know that all surgery is going to create scar tissue, and everyone forms a different level of scar tissue depending on your body, how it heals, what happened during the surgery, how much bleeding there was, what the surgeon was doing, and how invasive the surgery was. Again, there's lots of factors that determine your nutritional health going into it, what happens, that, and even stress has been shown to increase the level of scar tissue. So when we think about scar tissue, if I just take my shirt and I start to pull my shirt down, you can see that it starts to pull all the way up here into my neck. Well, now if you have scar tissue pulling you down in this direction, well, now you're going to have to do something to counteract that downward pull. Okay, so that's one factor. Now, when we think about surgery, so whether it's abdominal and or vaginal and or pelvic floor, pelvic region type surgery, well, now you have the weakness that's associated with that. After surgery, you're going to have weakness. You're not going to just bounce back and all of a sudden have the same dynamic control and stability that you had prior to surgery, especially these type of visceral or abdominal type surgeries. So there's that aspect too, and then the compensations that happen because of that. So one of the things I looked at when I looked at her overhead motion was just not her range, but then I'm like, let me feel your shoulders. Let me see what your shoulders feel like. Because one of the tests that we do as part of the integrative movement system is I want to see how hard are your shoulders pulling down upon your rib cage. So again, I'm an active kind of guy. I have some level of strength in my upper body. If I reach behind, if I'm standing behind my client and I go underneath her arms and I go to lift her arms up, her shoulders should feel very light for me to lift her shoulders up. Again, she's not a particularly large woman. She's tall, but she's not particularly large. So if I lift her shoulders up, it should feel light. I should be easily able to move her shoulders upon her rib cage. As I went to lift her arms up, basically her whole body was being lifted up because her shoulders are locked down upon her rib cage. And that's a very common strategy after you've had chronic neck pain as well as a long-standing history of abdominal and breast implant type surgeries. And again, this is why it's so important you understand your client's history. What if I took this woman and I started to put strength training and resistance training on top of a strategy where she's already gripping down, she's already bearing down, she also already has a very compressive and gripping type of shoulder strategy? I would make her worse. And her biggest concern, besides her primary goal, is like, I don't want to make my neck worse. I've just gotten myself into a better position working with a chiropractor and working with some other therapists. She's gotten herself into a very decent position, and she wants to safely and effectively work on her training. So one of the first things we had to do is address, why is her body pulling down? So I basically had this education with her. I'm like, we have to develop a strategy that helps you stop gripping down so much so that when we start to load your shoulders through rowing, through pressing, pushing and pulling type exercises, that your default is not to grip and bear down harder, because you will compress your subclavian arteries that are coming out underneath your clavicle in that thoracic outlet region. You're going to compress your brachial plexus, and that's likely what was contributing to a lot of our issues initially, and actually some of the loss of function. So first thing we did is we did some release work. We had to release where she's over gripping. Pectoralis minor was extremely short and tight. Her lats were extremely short and tight. So I did some release there. I taught her how to breathe. She had been taught how to breathe down here, and she was doing a very effective job at breathing there. I had to teach her how to breathe up and around her thorax. And then I gave her this exercise. This is one of the most valuable, in addition, secondary to breathing. Breathing being the most effective and most important exercise that we have to do, or activity we need to do with our clients that have shoulder, neck, and or low back issues. In fact, most musculoskeletal issues are breathing issues. So I had to do this exercise right here. Again, just pulling apart. And what you notice with so many individuals, even with light resistance, and lighter the resistance, the better, you see these people go into these clients go into these sort of contorted positions, and then they're shaking, and they notice how weak they are in actually keeping their shoulders elevated and open where they belong, or in a more optimal position, not where they belong, but in a more optimal position, because we haven't trained that position. We've been trained from day one as health and fitness professionals to pull down, bring the chest up and pull down. And this was actually her posture. So you think about a woman that has breast implants, former two abdominal surgeries or pelvic surgeries, and now she's using this compressive strategy. So I'm like, you have to get your rib cage here. You have to bring your shoulders back up where they belong. And now you have to train your shoulders to maintain this position. So that's why this exercise right here is such a powerful beginning exercise. Once we do our release, once we teach the client how to breathe up and around the thorax and the thoracic outlet region. We went back. I'm like, let's just see if we made a difference. I didn't really think it was going to make a difference that quickly because of the long-standing history she had. And she's like, oh my God, my arms go all the way up overhead. She didn't have to assist her arms. And she's like, holy cow, this is incredible. And now, after our second session, I added a couple more postural exercise things for her. And here's one of the things we did. Let me just grab these handles. We did a suspension row. And basically what I was teaching her is to use the same position that we just had with that band. Now we're going to use a suspension row. It's really the same exact position. I had her walk back just to give her a little bit of resistance. Same alignment, that long spine position, rib cage stacked above her pelvis, maintaining that position. And now she was just starting to do some suspension rows. So now she's learning how to use her posterior chain to maintain that open and wide shoulder position. And I'm like, let's recheck your shoulder alignment. She's like, I can't believe I'm doing this. I feel a little tension in my neck, but I was checking her neck the entire time. She wasn't overusing her neck. And she's like, oh, it feels even easier to lift my arms. So that tells me that we're reinforcing a more optimal strategy. And that's why range of motion becomes such a valuable objective tool for those of us that are working with corrective exercise strategies, because we want to make sure not just does a client feel better. Yes, obviously we want the client to feel better in the activities they're doing, and notice a subjective change. They feel better, that it's easier to move, decrease discomfort, things like that. However, as a practitioner, I want objective changes. If a client has to do this to raise their arms overhead, that's the range of motion they have. That's the strength level they have. If I do muscle testing, I want them to be here, more range of motion, better strength, better control, more optimal mechanics afterwards. That's the objective changes that I'm looking for and that I want to see and I need to see to know that we're on the right path, because we know that pain is so variable. Emotions, thoughts, again, the actual physical causes of pain or the chemical changes because of pain, the central nervous system changes because of pain. I can't change that. That's not my goal. I shouldn't say I can change it. I can modify it or impact it, but that's not what I'm trying to do. My goal is to impact the mechanical things that are leading to why this client has this suboptimal strategy. So range of motion becomes one of our most valuable assessment tools. So we see those objective changes, and then we know that we're on the right track, regardless of what happens to her subjectively. What's cool is when objective and subjective both improve, which they did, and she was very, very encouraged. And she sent me a text later on that day. She's like, "My husband and my son can't believe that the changes that have already happened in that 5 minute, interaction that we had today." So the important thing is, yes, I want to work her towards her primary goal of increasing muscle mass and strength and longevity. However, my primary goal right now is to help her create a strategy that supports her increasing strength and resistance and the ability to put on more muscle mass as she gets older so that she can safely and effectively continue to move towards her goals. We can measure that. Right. Let me just back up. So we're using our objective measurements so that we have things like range of motion, muscle strength, and even the in body where we're looking at muscle mass and lean body mass and body fat, that we're having those objective changes, not just does the client feel better or how do they feel. We're not just relying simply on the subjective information to allow us to know that the individual is moving in the right direction. And that's how you really become that go-to specialist for your current clients, and you attract more individuals just like these women who are looking for someone just like you, not doing the same old, just like, hey, you need to get stronger. You need to work posterior chain. You need to work, those back muscles because these muscles are so short and tight in the front. No, you have done your assessment. You've heard your client's history. You've married this together with their functional goals, and you've created a plan to improve their strategy and then move them strategically towards their functional goals, and you've helped them see that plan along the way. And yes, there's going to be a lot more education that needs to happen. There's probably going to be a lot of frustration as we get to a certain point and she gets stuck a little bit. However, she sees the overall picture, she sees the overall plan, and now it's just like most people, the patience of carrying through this process so that we can get her to where she ultimately wants to go, needs to go, and does the things, returns to the things that she loves to do, which is exercise and be physically active as she gets older. So this is Dr. Evan Osar with Integrative Movement Insider. We're sharing these strategies at 2 events this summer. There's only 2 events that we're doing for the rest of the year because of some outside issues that we'll talk about at a different time. We're going to be at Ideal World in California. Wow, in a month from now, 4 weeks from now. Check out Ideal World Convention. Amazing speakers. Janice and I will be there presenting for Functional Aging Institute as well as presenting for Ideal World on these very topics. We'll also be in Reston on the other side of the country, in Reston, Virginia, with our friends at DCAC, Jamie and her group of professionals out there. So super excited to be there as well. We're discussing these shoulder concepts as Janice will be talking about surgery. She talks a lot about the impact of surgery on core function, on posture, on function, and we'll give you lots of strategies around that. So we hope to see you at one of these events. And if not, we've got a webinar series coming up here later this summer. I'm still working on my book, the second edition of Corrective Exercise Solutions to Common Hip and Shoulder Dysfunction. So I have to finish that. Obviously, there's an outside issue, inside issue, personal issue that's going on in our lives that we need to address as well through all this. And again, we're just making sure that we stay focused on serving our community, serving you, staying connected to God, staying connected to his purpose, his mission for what we're doing here, and helping you up-level your skills and support you in being that model and that leader your current clients need, as well as helping you educate and up level so that you attract more individuals that need, want, and will pay you for your expertise. So thanks so much. Thanks for all the prayers. And we look forward to seeing you at a live event. And if not, on our webinar series. And if not, right here on Facebook Live and or our Instagram page, Discover IMI. Make it a great Sunday. Go out and be the light that you are here to be and that your clients are looking for. Make it a great day.